Good morning, folks. Ron Ray here with Turning 65 Solutions. In this morning's video, we are going to explain exactly who and how you qualify to receive Medicare benefits from the government. Now, our source today is directly from the U.S. Department of Health and Human Services website. And you can see the link right here. I'll put this same link down in the comments below. I'll also put a link to our website that talks about this topic in a little more detail down below. So you can go there and check it out. There's a lot more good information. But I always like to provide a third-party source that's a reputable source. This is the government website that talks about how to qualify for Medicare. And generally, most people are going to qualify for Medicare when they turn age 65. That means you worked and you paid into the Medicare system all your working life, or the railroad retirement system, and you now qualify for Medicare. Now, some younger people qualify for Medicare if they have disabilities or they have end-stage renal disease, which means they have dialysis or on dialysis or need a kidney or have a kidney transplant. Now, there's two parts to Medicare. You remember that from previous video, Part A and Part B. And for most people that we deal with, they're getting Medicare Part A on a premium-free basis. And the reason for that is that money, the pay for Medicare Part A, was withdrawn from your payroll check all your working life. So those payroll taxes, those Medicare taxes on your paycheck that you've seen for the last 30 years, that a portion of that goes to pay for Medicare Part A. So if you're turning 65, you may qualify to get Medicare Part A to pay premium free. So I'm just going to read the line right here. If you're receiving retirement benefits from Social Security or the Railroad Retirement Board, or you're eligible to receive Social Security or retirement benefits, but you have not yet filed. So remember, you have to be eligible, but you don't have to be drawing the money. Or you or your spouse had Medicare approved government employment. So maybe you didn't pay into Social Security because you worked for a government agency that didn't do that. However, you did qualify for pay into the Medicare program. Okay. Now, if you or your spouse did not pay Medicare taxes while you worked, and you're over age 65 or older, and a citizen, U.S. citizen, or permanent resident of the United States, you may qualify to buy Medicare Part A. So meaning you didn't work enough quarters to pay into the system, 40 quarters, in order to qualify for that premium-free Medicare Part A. So if that's not the case, then they will let you pay a little bit of extra money and get Medicare Part A that way. So if you're under 65, you can get Medicare Part A without having to pay premiums if you have been entitled to Social Security or Railroad Board disability benefits for 24 months. So once you go on Social Security disability, 24 months from the date that starts, and sometimes it may be backdated from the date you applied, but you'll need to check with Social Security on that. That'll vary case by case. You will qualify for Medicare. Also, if you are diagnosed with Lou Gehrig's disease, you don't have to wait the 24 months. You automatically get Social Security disability and Medicare starts right away. Or you go on kidney dialysis or receive a kidney transplant, you get Medicare Part A immediately. Okay. Now, while most people do not have to pay a premium for Medicare Part A, everyone must pay a premium for Medicare Part B. So Medicare Part A, remember, is the hospital insurance. That's what most people paid for through their payroll taxes all their working lives. Medicare Part B is your medical insurance. Nobody has paid for that yet until you enroll. So once you enroll in Medicare Part A, Medicare Part B, they're going to deduct the Medicare Part B premium, which is currently here in 2021, $148.50 a month. Now they're going to deduct that amount right from your Social Security check or your Railroad Retirement Board check. And if you're not, or your civil service pension check. Now, if you're not receiving benefits from either one of those, Social Security, Railroad Retirement, or Civil Service Retirement, then they're going to send you a bill in the mail, and that bill is a quarterly bill. It's every 3 months. So $148.50 times 3. Now, I'll give you a little hint. It's not on the page here, but once you get that first quarterly bill, there's a phone number on the back of that bill. You can call them and they will help you set that up on an automatic monthly bank draft out of your checking account. So instead of having to remember to send them a big check in the mail every 3 months, it's just drafted automatically once a month for a smaller amount out of your bank account. Okay. Now, Medicare Part D, we've talked about this before. Everybody with Medicare, regardless of income, health status, or prescription drug use, has access to the prescription drug plans. That's a little bit different. We talk about that in other videos, so I'm not going to cover that too much here. But that's how you qualify for Medicare. Number one, you worked and paid into the system, you or your spouse, or you're on Social Security disability, or you didn't work or didn't work enough and they allow you to pay for Medicare Part A. And you can qualify for Medicare Part B simply by being in the system and paying the premium for Medicare Part B. All right, so I know that that's a lot and it can be confusing. If you have any questions at all about this, please give us a call. The number is 830-217-6711. Also, look us up on the web at www.t65s.com. And there will be a link to the website down below where you can go to the page that talks about this topic also. Now, if you found the information in this video helpful, I hope you did. Please give us a thumbs up on the video down below. That helps YouTube get this video out to other people who are searching for the same information. And also subscribe to the channel. Click the little subscribe button and the little bell right beside it. And then you can be notified every time that we post a new video with some helpful information. So we hope you enjoyed it. Until the next video, bye folks.